if you have genetic history, in the early ages you start smoking, you are abusing your diet, and you're not exercising enough, then all these things will add up to put you up at almost 30 to 40% chance of developing heart disease. So that's why when you grade the people by predictive models, you can take them on a pathway. And I must say, people are now getting more and more educated about wellness, which is our focus, that you don't want people to get sick. They wanted them to stay well. Now, the point basically is, how much does one invest in one's own health? And that's where the problem or the challenge lies. When you are young, you throw caution to the wind because you are actually feel free, and you know that you will not exercise caution unless you are cautioned. So a young person, not recognizing the fact that they have a trailing family history, which can put them at a much higher risk, will go and behave like anybody else. And whether it is what they eat, and you know there is so much consumption of junk food at that age, there is, and the trap is very huge because junk food is delicious. There's nothing you can do. It's tempting. I mean, so easier said than done. But that flashing red light that I talked to you said about earlier is to be reminded to the individual who we have said is predictably headed for trouble. So I think that is the lay of the land that we need to give. Now, specifics of it is I will leave up to you, HK, to be able to give how, what to eat, how much to eat, when to eat, all that stuff. You have devoted your life to it, and that's great. But I just want to spread that awareness that the culmination of careless behavior, knowing your genes, additive risk factors, ends up in either getting a stent or a bypass. That is, if you're fortunate that those things are done before you get a major heart attack. And then once you get a heart attack, it's no pleasure. Life becomes a limited, and God forbid if somebody gets a real significant heart attack, then you are a cripple for life. So there is a lot of warning there. There is a lot to gain from being a little cautious, a little aware, and a little disciplined. Those are the three things you need.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैमहेल्थ पर सब्सक्राइब करना ना भूलें।